Good morning. We're here today with Carmen Vuitton, Managing Partner of Manicure in Texas. Good morning. How are you doing
Good
today?
morning, Chris. Great to see you.
You too. You too.
Thank you.
So we were just wondering, what's going on in the industry and what types of things keep you up at night?
Sure. I'm a speech pathologist by training, and one of the things that we have encountered in Texas and in several of our facilities is that we don't have bilingual therapists. We have, patients that are being admitted to our facilities all the time that are Spanish speaking only, and we don't always have therapists that can speak Spanish to treat them. And so my fear is that these patients are going untreated and not getting the services that they may need. And so one of the things that my partners and colleagues and I have done is develop Manicure. And it's actually an English and Spanish assessment of dysphagia and dysarthria that any speech pathologist could administer, or any dietitian could use, any nurse could use to find out about the history of the patient's swallowing deficit or disorder. And it even shows the therapist or the clinician how to pronounce the words in Spanish. So, these patients then can get the services that they need. So
That's a fantastic service,
you.
and I think that with the advent of staffing and the staffing crisis going on, this is something that
it's huge.
Yeah,
and speech pathologists, it's a critical shortage area, but even more so this last year, occupational therapy is such a shortage. And you're an occupational therapist by background, right?
That's
awesome.
right.
So you're in hot demand. Occupational therapists, I think nationwide, are really in demand. And it used to be historically that the occupational therapist did the feeding, worked with some of the self-feeding techniques, but also did a little bit of the oral training and education for the nursing staff. So occupational therapists could use this as well.
Right. And then one last question. With the regulation changes and that we know in the horizon we have episodic payments, do you foresee any service delivery changes or maybe innovations with regards to capitated bundled services?
Yeah, I'm concerned about that. Primarily, I'm in the SNF environment, and one of the things that we're trying to do with my full-time position is try to diversify and get involved in the home health sector, because I think there's really opportunity there as well to be able to provide therapy services. I think our seniors want to age in place and stay in their home for as long as they possibly can, and so we want to help be able to do that through the provision of good quality home health therapy.
Yeah.
And I think there's a real opportunity there. I think sometimes the home health therapists have gotten sort of a bad rap, and so have SNF therapists. And
that's right.
Right, wrong, or indifferent. There's some great providers out there, and then some not as quality oriented as we'd like them to be. So I think we're going to try to get into that market as well.
Thank you so much.
Absolutely.
Thanks for coming today. Great to
Great
see
to
you.
see you.
Thank you.